Hi, everyone. So good to have you here. This is always such a fun conversation, our candid conversations. And I'm just making sure we're live, and we are live. So, for those who don't know me, this is the face and the voice of Dr. Funke Afolabi Brown. And I'm really excited to bring here today to have a chat with us. Uh, really an incredible person. You know that really our mission is on Candid Conversations is empowering our audience with the information they need to really make the best choices in their lives when it comes to sleep. So if you've followed us for a while, you'll notice that I work with so many incredible collaborators to really just bring um, a very holistic approach to sleep health, right? And so I am so delighted to have Frank Mallon here, who is a doctor of physical therapy. And we'll be talking about how sleep can be affected by posture and our breathing. And I thought that was really fascinating when we met. And I said, okay, you know what? We have to have you come on and just kind of chat with us. So really good to have you today, Dr. Mallon.
Oh, really good to be here, Dr. Brown. Thank you so much for having me.
Yeah, absolutely. So maybe start by introducing yourself to.
Sure, sure. So my name is Frank Mallon. I have a doctorate of physical therapy. I've been in practice since 2010, and I've, I'm a specialist in the science of postural restoration, which is um, kind of a thought of looking at movement and how our body positions itself with respect to the asymmetries of the body. And the Postural Restoration Institute was started in 2000, and it's really the brainchild of the work of Ron Haruska out of Lincoln, Nebraska. And, it really looks at the asymmetries of all of the systems in our body. And if we split somebody down the center and looked at them, they really wouldn't ever be two mirror images, right? Because we have organs that we have on one side that we don't have on the other. Even the cortexes of our brain handle different kinds of information, and that's regardless of whether you're right-handed or left-handed. But we have the lobes of our lungs that are different sizes, different in quantity on one side versus the other. But one of the main asymmetries in our body is our diaphragm. And our diaphragm really isn't, you could almost break it down into not just one muscle, but really a right one and a left one, because they're different sizes. They attach differently to the lumbar spine. They're influenced in their position differently by the presence of organs that are nearby. The right one has a liver underneath it, which allows it to sit in a domed position a little bit more. The left one doesn't have that. It's smaller, it's flatter. So, even just, and every time that contracts as we breathe, 22,000 times a day, roughly, that means that if that diaphragm is not held in a position that kind of balances out some of that asymmetry, it makes it very easy for that diaphragm to end up kind of staying in a contracted state and kind of influencing our back position, our rib cage position, and ultimately our head and neck position in an effort to really just breathe. And very few of us walking around, if any, have two diaphragms that are working in an optimally synchronized state with our pelvic floor, with our head and neck and throat muscles. And so that really basically means that in some ways, over the course of the day, with every breath you take, it's likely that your body is going to prefer some amount of a twisted position, both in your rib cage, in your pelvis, in your head and neck. And that's often why people might find that they like to sit a certain way in the car, or they like to stand a certain way over one hip when they're standing in line at the store, or, for athletes, or, that might be why they're always straining one specific muscle that they're having trouble with, a hamstring that's always giving them problems, or even just for somebody who just needs to get through their day. It could be somebody who just, is always kind of wearing out, one joint. It's why maybe their right hip needed to be replaced, over a period of time. But for our purposes in this discussion tonight, it really means that if this body is altered and twisted in some way, it often means that the head and neck are going to have to kind of balance things out in order to kind of keep you looking forward and going about your day. But that can start to twist up the airway. And if we have a diaphragm that's in a contracted state, that means that it's going to be easier for our ribs to kind of get pulled forward, for our lumbar spine to tend to get pulled forward and in a twisted way. And it makes it harder for our neck muscles to shut off, for our head and neck to find an optimal position on the top of our cervical spine and maintain a good cervical lordosis. And it also, so it compromises mechanically the position of the airway already. It's like taking a hose and just kind of like twisting it a little bit. It's going to close it down. Yeah. But it also can, in that state of a contracted diaphragm or one that's kind of stuck and influencing our posture, that can also put more demand on neck muscles. It can influence our back muscles, but it can also make it harder for us to get the benefits of good diaphragmatic breathing and excursion, which results in physiologic rest. Being able to shut down the fight or flight, the sympathetic nervous system. So in a lot of ways, our ability to get that diaphragm synchronized on both sides of the body can really clear out a good amount of problems, both biomechanically, but also neurologically, both in our adrenal response and our hormone response, and but also in our body's just anxiety state, fight or flight, and so the way that we come up with movements and breathe is directly related to a lot of things that affect our inputs, and it can be where our sense of where we are in space based on what we see, what we hear, what we feel. So for people that might be having issues shutting off at the end of the night, and getting a good physiologic, or at the end of the day when they go to sleep, and getting a good physiologic state of rest, or also somebody who over the course of the night is clenching and grinding because they're trying to find out where they are in space. Now, I know you know better than anybody, there's a lot of reasons why that could be, right? But in some ways, in a lot of cases, it could, I would suggest, could be that someone, isn't getting proper inputs as far as an airway that's able to do what it's supposed to do, rib cages that can't expand, necks that are twisted. The body's trying to find an airway, or it's trying to find out where it is in space. And so for those reasons, I do a lot of work with dentists, where we look at optimizing, getting splints for people that are built a certain way to help balance out the proprioceptive components. A lot of times people will come to me and they'll already have a splint and made by a doctor, and I say, oh yeah, well, they just took a scan and then they told me to come pick it up, and because I'm grinding some teeth. Well, that's good, and a lot of people need those bumpers, so to speak. But we can also, through our approach, really make sure that head and neck are in an optimal position when we build the splint. And then also, as that person touches that splint and moves it from side to side, that they're feeling the proper teeth at the proper time. And that can really relax neck muscles and can help kind of the head sit in a way where we get that optimal 30-degree cervical lordosis at the neck and really optimize that airway. So the work that I do is really about helping people move and rest and breathe well throughout their day, but also could have a significant carryover to how they're sleeping and how they're able to really get good, deep, restful, therapeutic sleep at night.
Wow, that's really interesting. So, when I think about a physical therapist, I mean, I feel maybe it's just the way I was trained, but a lot of the work that I was familiar with that you do was around, of course, physical rehab. There's an injury and you're trying to provide some restorative strategies. How did you wind up in this like airway posture breathing space?
Yeah, yeah. Well, it's a good question, and you're certainly right, and that's a lot of the rehab PT world, and
Mhm,
there's certainly a need for that type of an approach, right? And that's the classic training. That's how I was trained,
mhm,
um, and my initial um, when you're in PT school, you learn to treat certain conditions by putting people in these boxes. As far as, oh well, if they have this, and this, they go in this box, and this is how you treat them. If they have this, and this, you go in this box, and this is how you treat them. And on some of my earlier clinical affiliations in PT school, I kind of started to realize, like, nobody really ever fits purely in that one box. It's like
mm,
they're kind of in that box, but they're also a little bit in this box, and a little bit in that box. So, like, then what do you do, right? So then we try the one box and we hope that works. And if it doesn't, well, then maybe let's try this other box. But at that point, you're wasting time and you're just
yeah,
kind of guessing and hoping for the best, right? So I really was very much into an approach that kind of looked at how, kind of the kinesiology of how our bodies move based on certain muscle overuse and underuse type patterns, which is a complicated approach. But even that, and it was really good at being able to take it and apply it to anybody. So
yeah,
whether you're, uh, a high level athlete, or you're, someone who just needs to get to the mailbox without pain, we could apply it and find what was helpful for you. But even that, I felt, was not quite giving me enough answers. And
mhm,
some people, they'd have trouble feeling certain muscles. They'd say, I don't feel that muscle turn on, or I could see that one muscle was weak, but they couldn't engage it. We couldn't get good enough balance out in their system, and there were these underlying patterns that it felt
yeah,
like we were fighting. And it wasn't until I kind of had the benefit of coming across this work of the Postural Restoration Institute that it really started to make sense, and it started to explain why those people that hadn't gotten better in the past
mm,
were not getting better, why we were hitting the wall with them. And so I started to really delve into taking those courses, and at the same time I was kind of dealing with my own little health journey. I was coming off of a bout of Hodgkin's lymphoma, and I had
wow,
just gotten a 6 months of chemotherapy, and I was
mm,
getting back to life, and I was and I just really wasn't feeling good. And I wasn't, at the point where I felt like I should have been. I was now X months of months and years, even out of chemo, and they kept telling me, "Oh no, you're fine, you're fine." I was having
yeah,
some neurologic type symptoms and some things that were really starting to get concerning and troublesome,
yeah,
and I wasn't getting good answers. And I was kind of seeing everybody in the system, the top people in Philly and all the major health systems, and nobody was able to really give me good answers. And I'd kind of gotten to the point where I pretty much just had come to the acceptance that I was kind of dying, and that it was just a matter of time until, that whatever I had became bad enough that it showed up on their tests. And it was getting harder and harder to function. And there was all sorts of a lot of anxiety and panic attacks and muscle twitching and all sorts of other things that weren't really kind of making sense. And I was taking some of these PRI courses, and there's the founder of the institute, great man, brilliant man, Ron Haruska. He was teaching this one course, and it was actually about the jaw
yeah,
and how teeth and the head and neck and how all that kind of affects a lot of this stuff. And at the end of the first day, he said to me, I was sitting in the front row, and at the time I had never met him. He didn't know who I was. And at the end of the first day, he said, tell me about your eye. And I said, what? And he said, yeah, you have one eye, that does this, whatever. And I had never known that. I mean, I was colorblind, but I never knew I had an eye condition. I never needed glasses, right? I always could see the bottom line on the eye test, right? And I said,
mhm,
well, he said, I bet you have some health things going on, don't you? Now, he had never met me. He had no idea.
wow,
And I said, yeah, so and then so fast forward a couple months, I was on a plane to Lincoln, Nebraska, and I was able to get the benefit of getting treated in their Prime program, which
mhm,
does a lot of integrative work. And if we come back to that asymmetry of the body, it also looks at how cortically and the position of our head and neck and our motor system is really regulated by in a lot of ways, how our jaw is positioned and how our teeth touch or don't, but also our visual system. So 60 to 80% of all of the connections in our brain, you could argue, have some ties to the visual system in some way. And traditional eye exams that just have you sitting in a chair, sitting still, looking at the bottom line, often don't necessarily investigate all the ways in which our brain uses our visual system for how that regulates where we are in space and our head and neck muscle tension and how we're going to stay grounded when we move through space and all these cool things.
Mm-hmm.
And so that kind of kicked off a journey for me in a way that was really, really transformational. And, you know, I started to realize that, number one, there's a lot of people like me out there who are having issues that they're not getting good enough answers for. And number two, you know, I need to be able to bring this to my area because, you know, unfortunately, not everybody can get on a plane to fly to Nebraska, one. And even if you do, it often requires some ongoing management. It wasn't like I just flew out that one time and then I had no problems. It just gave me the tools to be able to start to really effectively reverse some of these issues. So, I mean, I saw immediate changes without question. But, you know, as far as wanting to get better and better and better and you know, be at the point where I can fortunately say I am now, where I'm able to, you know, work long days and, you know, run around to different locations and have a crazy schedule and still be present for, you know, my wife and my kids. You know, there was a point in my life where I wouldn't have been able to do that. And it had been getting more and more likely that I wasn't going to be able to.
Wow.
So to be able to do that. And I thought, you know, I need to be able to bring this kind of stuff to the people in my area that need it. So from that time, I started working and integrating with neurooptometrists in the area, as well as multiple dentists in the area, where we look at where I'm on site with them and we're kind of investigating if they have visual issues. Is it not just what allows them to see, but also how their body's going to handle that prescription? And, you know, we'll have them standing and walking and trying different lenses in and out to see how the body responds. And same thing with the splints. You know, we'll have them stand and maybe we have to take a little bit of the splint down here or build it up a little bit here to balance it out. And the neck, head and neck and body position all tell us about what the harmony of the nervous system is and how the body likes it. And we find not just what is a good bumper for the teeth, but also what helps neurologically regulate some of that tension. And in a lot of cases, hopefully, is not just stopping you from wearing out your teeth when you grind, but is also helping address the reason why you're grinding in the first place.
Yeah. And I want to just call that out. A lot of times folks are, and you know, I really am very thankful for our dental colleagues. For some, teeth grinding, for many actually, teeth grinding is a symptom of something, like you're saying, like the visual issues was a symptom of something else. So teeth grinding is oftentimes a symptom of something. And so if you're being asked to wear, you know, a night guard or a mouth guard, I think it's important to still get evaluated, because it could be obstructive sleep apnea. It could be, it could be stress. It could be due to so many other factors, but making sure that that gets treated, because if we just put on a night guard and the reason is obstructive sleep apnea, we're not really treating the cause. We're just putting a Band-Aid on. So I really like the fact that you're also drilling down to what the root cause is. I think this is so important, because many people are chewing through and grinding through their night guard, and it's just like the cause has not been addressed.
Right.
So I think that's just really something important that I wanted to highlight.
Yeah, absolutely. 100% agree.
Yeah. Now, you know, we talked about, you know, and it sounds like, you know, eventually your posture, it sounds like your posture can impact your breathing, which then can impact your sleep. Are there times, because one thing I noticed, and maybe we'll just round up with this question, Are there times when it's your sleep, your breathing, the way you're breathing that ultimately impacts your posture? Do you get that?
Oh, absolutely.
Yeah.
I
Okay.
would argue that it actually, your posture is a
Yeah.
reflection of how well your brain and your body
Hmm.
is integrating many, many systems of your body and then finding a way to breathe.
Wow.
So it's taking in all this information
Mm-hmm.
from neurologically, how we feel, like the sense of where we are in space, how
Mm-hmm.
our head and neck position can get, what we hear, believe it or not, the vibration and frequency of what we hear, to where our head and neck are going to get positioned.
Mm-hmm.
And then underneath from our pelvis are so I actually just last week was given a presentation on how, our posture is really how well we manage pressure.
Mm-hmm.
And pressure, whether you're sleeping or you're standing, walking, whether you're lifting heavy weights, whether you're just have to get to your car, whatever it is, our ability to think, if you think of a soda can,
Yeah.
before you open a soda can, there's a lot of pressure in there.
Mm-hmm.
Okay. So as soon as you pop the top, you can crush it, no problem.
Mm-hmm.
Or if you, even if you bend it in the middle and you bend it, then you can crush it, no problem, right? So in our bodies, we need to maintain a soda can from like the glottis of our throat to the
Oh.
pelvic floor,
Mm.
and we need to keep that stacked well. So if we have a soda can,
Mm-hmm.
the main thing inside that soda can that needs to regulate that pressure up and down is the diaphragm. And
Mm-hmm.
on the front of the soda can, we got our abdominal wall. On the back of the soda can, we got we have our back muscles. But then
Yeah.
at the bottom, we have our pelvic floor that a
Mm-hmm.
lot of people are starting to pay attention to now. And
Yes.
then also, at the top here, we got this voice box, this
Mm-hmm.
larynx with the hyoid position. And the hyoid's position, which you know darn well about an airway and what's happening over the course of the night. So that hyoid and that pelvis need to be stacked well so that that diaphragm, and they have to be well enclosed by
Mm-hmm.
an abdominal wall that can control the position of the ribs, and a back and back muscles that can do what they need to do. But we
Mm-hmm.
need that diaphragm to piston up and down inside of it well, evenly on both sides. And when we do that, that's somebody who looks like they have good posture.
Wow.
So somebody who is too flexed
Mm-hmm.
is really probably too extended in some ways, and they've leaked out some pressure somewhere. And that flexion and that hunch is just their body's strategy for trying to optimize some pressure. So we can't take these people and just try to crank them back the other way into too much extension, because
Yeah.
that's not a good pressure system either,
Yeah.
right? Because now the pelvis is tilted forward, the ribs are lifted up, the abs have to relax in order to accommodate that contraction of
Yeah.
the diaphragm, and that diaphragm can't move up and down.
Got it.
So then we will have, and what will happen, Dr. Brown, when we do that is then our head and necks have to go forward to open up that airway.
Yeah.
So it's like these ribs are getting pulled up into our throat, and the head's like, well, man, we got to breathe. What are we going to do here? So then the head just goes forward. And that could be somebody whose jaw likes to slip back. Could be, hyoid that isn't well positioned to optimize that 30-degree cervical lordosis. So posture, I will argue till I'm blue in the face that it's not just a musculoskeletal.
Mm.
It's not like, oh, I got these rounded shoulders, let me do a lot of these band exercises to get
Yeah.
my shoulders back, right?
Yeah.
So it's the musculoskeletal is just one piece of it. It's relevant, sure, but really there's so many other, think about what your posture is like after Thanksgiving dinner.
Oh, yeah.
Different, right? So,
Yeah.
so if somebody has GI issues, or somebody has lymphatic issues,
Yeah.
or somebody has, anything cardiovascular,
Mhm.
all these, but really and it's fluid. It's always changing. It's not
Yeah.
like, oh, here, that's your body, good posture, hold that, don't move. Good.
Mm-hmm.
Keep that. No, go live life. That's not realistic, right?
I
So it's
know.
always integrating too with how we send. Your posture will be different if you're sitting right now where you are,
Mm-hmm.
you're standing at the edge of the cliff of the Grand Canyon, right? You're gonna be like, oh, so the sensory experience significantly influences where we put ourselves in space,
Got
how
it.
we manage internally everything we have to do to
Mhm.
integrate all the pieces, all our different systems.
Yeah,
And then from there, we got to figure out how to breathe, right? So, and our bodies will never go into a position, that we can't breathe well in. So
absolutely.
the airway we're always going to find a way to
Mm-hmm.
find an airway.
Mm-hmm.
And that's always the first and foremost priority for our body.
Yeah. So I
Doesn't care if it's going to have to overuse some neck muscles to get you there.
yeah,
That's small potatoes. If the alternative is not breathing, the
it's
airway is always going to win.
absolutely. So I think that's a great place to kind of segue to our last question. So here are people who are like, oh wow, I can assure you, folks that are currently watching this video and folks that are going to come back and watch it are probably sitting upright as you as they're
Mhm.
watching us.
Yeah, yeah,
Right?
yeah.
So
Yeah,
give us maybe 5 tips, whatever, on how to optimize, your breathing
Mhm.
as well as posture. Like whatever you think people can live with to just say, okay, let me start to pay attention to this more.
Yeah.
Um, and I think that would be just kind of a good way to round this up. So something practical that people can do when it comes to breathing. Again, people breathe really shallow. I'm not sure how much that impacts posture overall, as
Mhm.
well as how they can optimize their posture, even for everyday living.
Absolutely. That's a great question. So here, what I would say, so imagine you're sitting in a chair, just like you are right now. First, and you say, okay, I'm going to stand up straight, right? Well, as soon as you start up here trying to do stuff, it's too late. What I would say is first feel the floor.
Hmm.
So give your brain that sense of the floor to shut off some of these muscles that are going to want to pull you up and out and would be compromising your soda can. So
Hmm.
I would say feet flat, then feel your butt bones. Feel your body on your butt bones. A lot of people sit too extended or they have too much lumbar roll.
Hmm.
They're pushed forward and they're in hyperlordosis, too much extension in their lumbar spine. That becomes a problem for the pelvic floor's ability to stay underneath you and get that diaphragm to bounce. So I would say feel your butt bones and then make sure that you can feel your back, when possible, relaxed into the back of the chair.
Hmm.
So not because we need you to slump, but because we want your back to feel that it can relax into it.
Hmm.
So if you got feet flat, you're on your butt bones, and you feel your back relaxed into the back of the chair. Now I would say take a breath in and feel how that air can come up here and expand this stuff. Now I would say exhale and don't get shorter. So take a good long exhale, but don't do this to exhale.
Oh,
And you may feel some abdominals just kind of turn on
yeah.
and come in as you're exhaling. So then pause, let your tongue get to the roof of the mouth, and then take another inhale. And what we're looking for is elongation, not extension where we're cranking back the other way, but rather elongation. It's like a string pulling you up to the ceiling.
Hmm.
And then exhale, but don't get shorter. So now those abs can come in. And as long as you've stayed on your butt bones and you keep your back relaxed into the back of the chair, you'll get a little bit of these abdominals to be able to work and position themselves over that diaphragm and put it in a good starting position. And so I mean, that's a quick and easy thing. I think that anytime you can feel your feet flat on the ground, feel your butt bones, and feel your back relaxed into a chair, that's a really good thing. But the main thing also you could do is just take longer exhales throughout your day. Because the exhales put your diaphragm in a better starting position to contract from so that you can get the benefit of good diaphragmatic excursion and expansion. The problem is if your diaphragm's already contracted, descended, then you're trying to just inhale from there. The only way you're going to do it is with your neck or your back, right? So people that are just, if someone's just being told to just let their belly expand, and we're not putting that diaphragm in a good position first, then it could be actually increasing some of the extension and the compression in their spine, or putting more demand on their neck. So
Mhm.
I think I always use the analogy of the diaphragm being like a spring. So you want to, when you exhale, those ribs come down and that diaphragm can dome and relax inside you. That's like taking a spring and stretching it, so that when you then need it to contract and you take an inhale, now you let go. There's a lot of power in that diaphragm to be able to
Hmm.
really elongate you and work in a vertical position to expand things. And that means that your rib cage can now rotate around here. So maybe less work on the scalenes
Yeah.
and getting those upper ribs to move. So you'll have a better airway. But if you haven't pulled that spring, and you just give it a little bit, and then you now want it to, and you let go, there's no power in that diaphragm. But we
Yeah.
have to build the power from the inside out and put that diaphragm in a good position, keeping your feet flat, butt bones on the chair, and your back relaxed helps give you a better chance at stacking the soda can, so that diaphragm can get a better excursion.
Oh, so good. So it sounds like, because I do, with sleep, one of the things we say is, breathing exercises are good to help
Mm-hmm.
relax.
Mm-hmm.
So it sounds like, in order to practically implement this, would be saying, maybe, it's bedtime, you've had a long day, and, you have some breathing exercises as part of your routine. It sounds like the posture you describe would be the most ideal. Um,
That would be a good way to do it. Yeah,
yeah.
you could also do it even laying down. Lay down on your back with your head relaxed and supported. Maybe a
Mhm.
little bit of a towel roll underneath your neck. So you don't want so much pillow that your head is pushed up and your neck's all crunched. You don't want so little that your head is back and your neck is overly
Mhm.
flattened, right? We don't want to reverse cervical lordosis. So just a
Yeah.
little bit of a towel roll underneath your neck where your head can relax back. And with knees bent up, just working on some longer exhales.
Longer
You
exhale.
can put your hands right here on your ribs, and when you
Mhm.
exhale, at the end of that exhale, you'll feel like a little bit of a drop where those ribs drop in.
Mm.
That's where you have that means that underneath it your diaphragm has domed and it's gotten in a good position.
Mm.
What I would say is then pause, maybe 1 second, then work to 2, 3, 4. But in that pause, let your tongue then go to the roof of your mouth, just like
Yeah.
we want, and then silently, gently inhale, so that you give the air a chance to expand up here where you got lungs and ribs that were meant to expand, so that it's not all just belly popped out and
Yeah.
this stays crunched and just your back's
Mm.
extending to do it. So because really most people need thorax elongation. The
Mhm.
ribs are too flared up and too kind of scrunched, and then
Yeah.
that's why they'll either go this way to manage pressure, or when they're standing, they'll extend too much because the abs can't hold that rib cage well over the diaphragm with the pelvic floor getting underneath it.
So good. This is all so, so good. I think we definitely are going to have you come back, because
I'd be happy to.
so many questions, pillows, the mattress, all that. But we're
Yeah,
not going to.
yeah. Oh, let's get
Hopefully,
into it.
like,
Let's do it.
stay connected and stay subscribed to this YouTube channel, because this is going to be on YouTube as well. So that
Okay.
when next Frank comes, we could talk about so many other things to support posture. This has been amazing. So, where can people find you?
Sure. So you can you could go to my website. It is www.renaissance PT and wellness, all one word, RENAISSANCE and wellness.com. Or you could email me at and you can connect with me through the website. There's a place where you can connect with us. I'll get that directly. You could also email me at Renaissance Physical Therapy, all one word, at gmail.com. Or you could call me at 267-402-0242.
Wonderful, wonderful. And we'll leave all this in the notes as well. This has been just so fascinating. I've learned so much. I'm just so aware now, and I think that exaggerated extension is something I'm definitely taking away, and
Yeah.
really about how to actually breathe properly.
Yeah.
I think is also something else I'm going to take away. So thank you so much for coming.
My pleasure. Thank you so much for having me, Dr. Brown. I really appreciate you.
Absolutely. And listen, if you're out there and you are looking for a sleep practice where you can feel heard and you can feel seen and have your sleep questions answered, using kind of like this really holistic lens so that we can finally put your sleep issues to rest, you have to make an appointment with us at therestfulsleepplace.com. So that's www.therestfulsleepplace.com. We're seeing patients in person as well as virtually. So in person in Pennsylvania, virtually if you are in California, Pennsylvania, of course, and New Jersey. You can also give us a call at 215-607-8297. It's been amazing spending time with you all today. And I hope until next time, you all rest well.
Thank you, everybody.